And another question, now lately, I am having diabetes also. It is 125 fasting and around 180 PP. My doctor says there is no need for medicine, it's okay with your age. These are my two questions, sir. Whether I should go for angiography or not?
Hello, can you hear me?
Yes, sir, yes, sir.
Okay. Thank you very much for that question. 72 years old is still young. You're quite young. The reason is that the life expectancy in India, when I looked at it long ago, when India became independent in 1947, if I'm not mistaken, was very low, maybe 50 or 60, because people used to die of infectious disease. Similarly, the life expectancy in Singapore, when we became independent more than 50 years ago, was about 60 or something. Today, the life expectancy in India has crossed 65 to 70. And in Kerala, it is about 75 or something. In certain countries, certain states, it is low. The life expectancy in Singapore for women is 83, and for men, 80. We are one of the top 5. So why has it come up? Is it just because of angioplasty and stenting? The reason is not. Mainly because of hygiene and prevention of infectious disease. Because when the waterborne infections are controlled, many disorders like diarrheal disorders will come down. But coming back to your question of the second one, diabetes, for example, yes, when your sugar is a bit high, which is the case in your case, you can control it to a large extent by diet and exercise. But if it goes beyond 200 milligram, and so usually 170 something, it can be controlled by diet and diet and exercise. But I suppose you can control by diet and exercise, if particularly low carbohydrate diet and exercise. But if not, it is good to take some medicine. The reason is diabetes is one of the risk factors for coronary artery disease. And coming back to the second thing, if you've got a chest disease, chest pain, etc., you can either do a CT coronary if you are not very prepared for the angiogram, then you can do a CT. Supposing you do an angiogram, if your block is say less than 70%, probably you don't need any stenting or anything. But if more than that, it is better to do angioplasty and stenting. So it depends on what you see in these two modalities of investigations. Is it okay? Thank you.
Hello, I'm Shivanand. This question is open to all of you, anyone who is familiar can answer. My question is, I saw a few slides where mentioned the trinity of Ayurveda, where 3 schools of thoughts were there who promoted the herbs and medicines. So my question is, like, most of the Ayurvedic medicines are herbs and minerals, and there are some medicines which are animal-based for specific conditions. Is it common to all the 3 schools of thoughts, or is it only in particular school of thoughts that later in the part of the time it became common to use animal-based products?
We made it in the first presentation that everything in the universe is potentially medicinal. There is nothing that is not medicinal. Everything can become, it is a contextual. And we have got 3 kinds of criteria. Medicines are divided into criteria. One, animal products, minerals and metals, and biological elements like plants. So the majority of the practitioners, southern side of India, use medicinal plants as the main resource base for medicines. But there are minerals and metals. There is a separate branch evolved in Ayurveda. There is a separate branch, separate science called Siddha, which uses minerals and metals as the mainstream medication. And the animal products, there are 62 animal products are being used in Ayurveda, which are all needed for different conditions. So there is no question of this or that. Depending upon the condition, we have to use different materials for correction of imbalance in the system. Is that clear?
All the 3
just
systems
to
which you are
add to
asking
what you
about.
said, sorry. Okay, sir, please.
You told about 3 peoples are there, like Sharaka, Shrita, and Bhagbata. All have really emphasized and told about all this animal product, mineral product, and plant product.
The only exception is, of course, mercury was never used in the original 3. Mercury was alien to India. It was brought only from Greece much later. And so mercury as a source of medicine was much later into into Ayurveda. It was never used in the traditional 3 books.
I just want to add what they said. Yes, most of the medicines in Ayurveda are of plant origin. Animal origin include, of course, milk, which is a very important thing. So you can't say no animal origin. But in Chinese medicine, a lot of metals are also used. They used to use mercury and arsenic. Both are very toxic. So we, in fact, in Singapore, we also had to remove all these medications from time to time. So we are very particular that the content of heavy metals are very low in certain medication. Heavy metals can be bad. So we have to analyze. I'm sure the Ayurvedic medicine don't have much of a heavy metal for that matter.
Hi. My question is to all the doctors over there. Like we just learned about the role of Ayurveda in the prevention aspect of cardiology. As far as the treatment aspect of Ayurveda goes, like how is it helpful as the complementary as well as alternative medicine in the patients who already have heart disease or have already undergone angioplasty or bypass?
Yeah, so to answer your question, the primary role is as a preventive and as an adjuvant. You know, the strength of Ayurveda is not so much in the management of acute conditions. Acute conditions require different types of intervention. That's where, as doctor put it, you know, the life expectancy has come through, has increased dramatically because we are able to deal with emergencies much better with Western medicine. Whereas when you talk about primarily preventing the cardiac condition, you know, there is a lot that you can do with diet, lifestyle and so on, and with the Ayurvedic herbs. Having said that, still Ayurveda has a role to play. There are several medicines and therapeutic procedures in Ayurveda which can be an add-on to the current medication and to Western medicine. When you talk about even people who have undergone a bypass or people who have been on angioplasty and so on and so forth, even in certain conductive diseases of the heart, Ayurvedic treatment is seen to be effective. I mean, there is a whole school of, even in conventional medicine, there's a Dr. Dean Ornish in the US who has shown that you can reverse heart disease without drugs. It's proven through PET scans, the state-of-the-art studies, but it calls for extreme rigor in terms of how you deal with your diet, your lifestyle, stress management, visualization. So you have to use multiple factors to change things in your favor. It's not an easy game. The only sort of opposition to this school is that not everybody is ready to follow that, and it's not easy to follow. If one can stick to those regimen very strictly, it's been shown that you can even reverse heart disease. But it's hardly less than a very small percentage of people who are ready to take that sort of a big change in their lifestyle. So I think that's the limiting factor. Otherwise, body can heal itself. Body is the best healer. That's what Ayurveda believes in.
There are anecdotal experience of physicians who are successfully treating heart blocks of various degrees. There are regimens that are told in Ayurveda, but there are no much documented data to prove that so many cases has been treated. There are many anecdotal cases, and there are a category of medicine which are told in Ayurveda, which are told to be Lekaniya Dravyas, Medohara Dravyas, Pajaniya Dravyas. The combination of these in different dosage forms or long period of time, along with a conducive lifestyle as he suggested, can definitely help bring down the heart block on a certain period of time. Dean Ornish study, 2,500 people have been followed for more than 3 years, seen that heart blocks can be melted if you properly follow certain procedure told in Ayurveda and Yoga. The problem today is that we want a quick fix. There is a block, we want to immediately get it removed. That is a different way of doing and dealing with that condition than correcting it by your own disciplined way of doing. So the question can be answered in 2 ways. Whether you want to have a long period of successful quality life with correcting your lifestyle and improving your life, or put a stent. Once you put a stent, you are lifelong going to be depending on medicine. Ask him, we'll tell that you have to take blood thinner, you have to take anticoagulant, and this problem will be there. You cannot take any other medicine, you have to be. So many restrictions come. So depending upon the condition, there can, and prevention and promotion is one of the strongest aspects of Ayurveda. It talks about how we can keep your heart healthy. There are Hridya Dravyas, Hridya Ganas, cardiotonic combinations told in Ayurveda, which can be part of your diet and which can be part of your medicine also. And also lifestyle. If you do Surya Namaskar every day, 13 Surya Namaskar with 13 mantras, 13 steps, every day looking at the sun, that many of these lifestyle diseases can be prevented. So we have to take each and every component in its own, with its own value, then it can be corrected.
For the question, what can we do when post or pre-treatment? As we have been telling, it's a preventive medicine, but there are some cases, if a person is having 1 or 2 blocks, definitely a PTCA can be done or it can go for a bypass, CABG. But if there are multiple blocks, even the cardiologist will tell them they cannot do. If they have more than 37 blocks, definitely then they have to live on medicines. In that kind of conditions also, Ayurveda is really helping. So it's quite a number of cases which we have dealt with. And there are some cases, because we look at it as a Mamsa Vikriti, and there are cases with children who wanted to get ASD or some other problems. Even with Ayurvedic medicine, there are improvement, and there has been documentation done, and we have published in our medicine book or Ayurved line. So, but one thing is, everybody else, they don't come first as Ayurveda. They go to the other system, then come to Ayurveda. So, but when they follow after a stent or a CABG, they follow all the regimen. If they really follow before that, they will not get it. That is what we want to tell it affirmatively.
Well, I would just like to add that Ayurveda is not only, the drugs and interventions in the form of medicines. As said many times since morning, Ayurveda is essentially a science of life. It involves Dinacharya, Ritucharya, and all other do's and don'ts which need to be followed regarding your lifestyle and regarding your food habits. You cannot undergo scalpel again and again. Actually, once you have got a CABG done or you have got a angioplasty done, you cannot undergo it again and again for every other artery. So ultimately, you have to resort to lifestyle and medications. And there have been several herbal formulations, herbo-mineral formulations that have been advocated and studied scientifically. You can just Google and you can find a lot of publications on that, where these herbs and these formulations have played a role as an adjuvant only in maintaining the patency of these coronary arteries for that reason. And recently there has been a human clinical trial concluded in All India Institute of Medical Sciences, New Delhi, where a herb, commonly used herb called Arjuna, has been used and studied for congestive heart failure. And you can see the publication. The results have been quite encouraging. There were 2 groups. One group was given the standard of care in allopathic, and the other group was given standard of care plus Arjuna capsule. So this was an add-on, as an adjuvant it was given to the patients, and the patients of the second group benefited better as compared to the first group, both in terms of objective and subjective parameters. Objective parameters like ejection fraction, it showed very little improvement, but the subjective parameters like Kansas City cardiomyopathy questionnaire and the 6-minute walk test, they showed considerable improvement in the second group of patients. So there are indeed promising formulations and interventions in Ayurveda. What we need to do is to integrate, join hands, and try to find out better solutions.
Good afternoon, everyone. I just need to clarify something. Is it true that if you take English medicine, you are not allowed to take Ayurveda or homeopathy medicine?
No, it's not so. It's not there as a rule, But there are certain drugs which have been identified. There are herb-drug interactions. If you are on a particular medicine, you need to avoid that particular drug. So these are isolated instances. This should not come as a rule.
Ma'am, one minute. When there was research happened for a tuberculosis, rifamycin, it enhanced, the bioenhancing was done by adding pepper to it. So they are in complementary, and because they are a natural origin, there is no harm in taking an Ayurvedic medicine if you are already in an allopathy medicine. That's what I tell to all my patients. See, it's different plants you're eating, you're eating different greens. The one green which you don't know, that's why you're giving it. So, and definitely people are really scared and they don't want to come here. But when you see the researchers, they have found out that many plant materials are bioenhancers and they go in pro with it.
Happened in that, but so far what we follow as practitioner is that give a gap of 45 minutes to 30 minutes between two medicine, taking into consideration the time for metabolism of allopathy medicine to the tissue, so the other medicine can go. But certain medicine like blood thinners, when you are taking blood thinners of heart people, it is not advisable to give more Tikshna Dravyas again to them because it can cause bleeding. So that kind of, we have to have an understanding of medicine in certain cases of sensitivity, like cardiac case, congestive cardiac conditions. A condition like COPDs and lung chronic diseases, Ayurveda can do a great role in complementing because they are poisoning the lungs by giving pure oxygen. So we can expand by Ayurvedic herbs and Ayurvedic methods. So it depends upon case-to-case conditions, but drug-to-drug interaction is still a very great gray area to say more about it. But the simple understanding is that most of the medicine get metabolized by 30 to 45 minutes the system, so you can safely give other biologically active Ayurvedic medicines after that.
Good afternoon, sir. I have two questions. One is about me. I am a diabetic patient for the last 10, 12 years. I've been controlling with a lot of good diet and exercise and all that. I'm currently being administered with Galvus Med and the sugar under fair control. But always, there is some fear that any English medicine has got a side effect or so. Since I am from Kerala, I'm always I've been in Kerala for a long time, a believer in Ayurvedic system. So, but my mind says, get back into Ayurvedic system. So I'm not very sure, even after following for about several years, do we have a good Ayurvedic medicine to go back for my diabetes? That is question number one. Question number two, one of my close relative who is also about 62 years is suffering from a severe knee pain and arthritis, and his knees are swollen. He is literally limping. I want to suggest him some Ayurvedic system so that he can come out of this problem.
Okay, to answer to your first question, diabetes, we do have treatments in Ayurveda for diabetes, but it depends on the extent of problem that you have. Many people, there are again two stages not two, but there are several as we understand them now. But primarily you can divide them into two stages. One where the body is capable of producing enough amount of insulin, but the bigger problem is that your insulin is not working. There is a phenomenon called insulin resistance. So even the response to glucose from the pancreas in its ability to produce insulin is hampered in some way, but pancreas is not damaged. In that condition, very often we are able to see that with Ayurvedic medicines, we are able to keep the patient under very good control. But Ayurveda also says that diabetes is not a curable disease. You can only keep it under control. It's called yapya. Means you can keep it under control. It's not sadhya. Sadhya means completely curable. Ayurveda also says that diabetes is only yapya or controllable. The tendency to get back into the problem is always there. But Ayurveda also understands, as in modern medicine, that it's a progressive disease and that more and more complications set in with duration of time. So once the disease becomes chronic and you are not able to keep your blood sugar under control with those natural processes, diet, lifestyle and certain herbal products, from my experience at least, I have found some people definitely need modern medicine as a support to keep it under control. I think the primary reason is we are not really able to live an ideal lifestyle. If you are able to do that, to a great extent problems can be under control. But however much we wish to do that, I think current day situations don't permit us to lead the ideal lifestyle with adequate quantity of rest, adequate quantity of exercise, diet control in the proper sense of how Ayurveda talks about. I think today's society, we don't prioritize it as much as we can. So there is a limitation from the practical perspective. So we should acknowledge that, but the critical factor is whether our sugar is under control. It's not a matter of whether we are able to keep it under control with just diet and exercise, or diet, exercise and herbs, or diet, exercise, herbs and modern medicine, or if even that doesn't work, you'll have to have insulin. exogenous insulin will also be necessary. The critical factor is whether we are able to keep our sugar under control or not. If not, we are going to have serious damage to all tissues in the body. So keeping that in mind, it's always risk versus benefit. Ayurveda also never said that all diseases can be cured with diet and lifestyle. They never said herbs can cure everything. They also had surgery. When a tissue is damaged beyond repair, you need to remove the part. That was also part of Ayurveda. So Ayurveda has been very pragmatic in saying that the solution has to be proportionate to the problem. That's the main statement that Ayurveda makes. It's not, so you need to choose at what level of the problem you are at, and then the intervention is based on that level. And the mildest or most natural of the interventions is the best, because it has the least adverse effects. So if you are able to reverse something with just diet, that is probably the best. Diet and lifestyle is the best intervention. Sometimes that is not able to reverse the entire thing, then you need what we call as herbal medicines. And then that's in the quest for more powerful substances is where Ayurveda also started using the more powerful substances like metals and minerals and surgery as well. So Ayurveda is actually, as a philosophy, using the entire spectrum, including what we know today as modern medicine. So I'm sure Ayurveda says if something is deficient in the body, that particular substance is the biggest medicine for that particular condition. And so, from that perspective, even administering insulin is not anything against the spirit of Ayurveda. That's my personal take on that. And with respect to your second problem, I think you can meet osteoarthritis is one of the conditions that all Ayurvedic doctors treat very effectively. So you can meet a senior Ayurvedic, there are good doctors here in APAS, very senior Ayurvedic physicians are available in Singapore. You can get a personal consultation, because it's not like one disease, one drug. That's not the way Ayurveda looks at it. We need to evaluate the patient, what are the causative factors, what's the stage of the problem, so on and so forth. The detailed consultation will give rise to what exact treatment would benefit the patient. There will also be situations where if the knee is completely damaged, a replacement may be needed. So there is nothing that Ayurveda is a cure-all phenomenon, it's not. But Ayurveda in concept is a solution, because it talks about the entire spectrum of interventions that can be used appropriate to the condition. I hope I answered your question.
Well, I would like to add that, there is another dimension to diabetes. Diabetes management doesn't only mean keeping a strict control on your blood sugar levels. Well, that is one dimension. More important dimension is the complications that happen because of long-standing high blood sugar levels, the microangiopathies and the macroangiopathies. So, which manifest later on as, retinopathy, neuropathy, nephropathy and all those things. So, whenever you are talking about treatment from Ayurvedic perspective, don't look from the, lowering of the blood sugar point of view that the drug is effective or not effective. Maybe definitely there is other dimension to these drugs. These drugs are more helpful in managing the complications, in preventing the onset of complications and decreasing the severity of these complications of long-standing diabetes. So it's not so that not good medicines are available in Ayurveda, but as said since morning, Ayurveda is a highly individualized approach. So there is no one remedy or one herb or one herbal formulation that will suit everybody or that will equally benefit everybody. So you need to consult the nearest physician, and the patient needs to discuss a lot of things with the doctor. Then only you can arrive at a compatible remedy. So from Ayurvedic perspective, don't look at the action of lowering the blood sugar as the parameter whether the drug is acting on you or not. So this is what I need to submit.
I think we can just hold on for the question and answer session for the next thing, so that we can continue the talk. I know there are many questions that are going to come. You will get the speakers at the lunchtime and even post 5 o'clock to answer your questions. And let's now first, before going for our lunch break, I request Dr. Pradeep Dua to felicitate Dr. V.P. Nair. I request Dr. Ajit Kumar to felicitate Dr. G.G. Gangadharan. I request Dr. Joshi to felicitate Dr. Ramesh Varya. Request Dr. Ajit Kumar to felicitate Mr. Pradeep from Himalaya Drug Company. Dr. Joshi to felicitate Dr. Shanti Vijaypal. And Dr. Ajit to felicitate Dr. Vijaypal. We will have 45 minutes lunch break and we meet here back at 2:30. Thank you.